most famous physical therapist on the internet.
Well, hi there, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Finally, you agree, Brad. Today we're going to talk about frozen shoulder, step-by-step exercise and pain relief program for the 3 phases of adhesive capsulitis, which is frozen shoulder. We already did the video for the first phase, which is the freezing phase.
Right.
This video is for the frozen phase. Just to recap real quick.
Sure.
There's 3 phases when you have frozen shoulder. You pretty much, there's not a lot known about frozen shoulder, but what is known, there's generally 3 phases and they can take a while. First phase, that's freezing phase. You lose motion, it's painful, it can last 6 to 9 weeks.
Sure.
The frozen phase, that's the one we're going to talk about now, how to treat during that one.
Yep.
There's less pain, but the stiffness remains. That's why we're going to get a little more aggressive. That lasts 4 to 6 months. The final phase, the thawing phase, things start to improve. The strength and range of motion usually returns.
Yep.
That can last 6 months to 2 years. So the whole thing can last 6 months to 12 years, 2 years, not 12 years. So it can be a little discouraging, but stick with it. It doesn't mean you're going to have pain that entire time.
Yeah.
And some people do a lot better than the 2 years.
Right. So be optimistic.
Yeah. All right. So what we're doing here is we're going to use a broomstick or the Booyah stick. We've just found that to be the most helpful thing with stretching the shoulder at this point. So you could take a broomstick handle, or you could take a piece of PVC pipe. It helps to have tips on the end.
Right.
So they grip the floor, or some people, one lady, she took a broomstick and she just wrapped tape around the bottom of it.
Sure. Yeah.
So we're not making you buy a Booyah stick. We just want to make sure that you know it works quite well, and also other things work.
Right. Anything about 5 foot long, inch or so in diameter.
Okay. Always we're concerned about posture. So the first thing we're going to have you do every day is you're going to stick the stick underneath the shoulder blades like this. You're going to squeeze back, and you're stretching the back a little bit, and you're doing a chin tuck at the same time. So, yep, this is where Brad and I can face each other, and
yeah, you want to get away from that.
Yeah, it stretches the back.
Person away from you.
Stretches the shoulders back, and you can do a chin tuck at the same time.
You can work that back too. It actually feels good. It's great for your muscles and that posture. There's more than one benefit from that.
There we go. All right, the next one we're going to do, this is one of the core ones we like to do. We call it the Progressive Statue of Liberty. It looks like the Statue of Liberty. Brad named it. And this is one, you can do the posture one we just did, and this one, you can keep doing this one every day.
Yeah.
And we're just going to have you do 10 repetitions, but it's a good one to do even as maintenance, to be honest with you.
Yep.
So, Brad, do you want to start showing how this works?
So depending on how high your shoulder, let's say mine is stiff and I get to there, I'm going to just grab here. I'm going to straighten my arm out and it's starting to stretch. And if I want more stretch, I just simply lean into it and give it that more stretch and come back. Now we're going to recommend, pressure on, pressure off as far as the cadence or how long you put the stretch. If you want to do a longer stretch, if that works better for you, that would be fine.
Right, just however it works out for you.
Exactly.
But do you want to show Brad how it's a sneaky way of getting motion here?
Yeah.
Go all the way like that once.
Yeah. So if I maintain my shoulder at that position, I sit up, you can see.
Yep, look how far it really is.
I'm up to there. You just don't notice it because my trunk is leaning forward. But the weight of the arm is being supported by the hand and the stick, and that allows the shoulder to relax and stretch better with less pain.
And we call it progressive because you can progressively work your way up the stick over time.
Exactly.
So you can go further and further, which is going to cause more and more stretch.
Yep.
You can even push down on the stick a little bit while you're pushing it, that helps set the shoulder in place.
Yep.
So like I'm trying to stab the stick down into the floor, that works really well too. So while I'm leaning forward, I'm trying to stab the stick into the floor.
And this is where the stick needs to grip the floor. If it's a slippery floor and you don't have a rubber tip and it slips around, it will not work very well.
It's not going to work. That's where, and it's the right size. We like the Booyah stick too because it's got kind of a tactile feel where it really grips.
Yeah, it really we just love it. That's why we use them.
Yeah. All right. So those two exercises you're going to continue to do every day. That's 10 times. You're going to do that. 10 times you're going to do the chin tucks and the shoulder extension. Now these next exercises, you're going to do one of them.
Okay.
Depending on how you progressed. The first one you're going to try is extension of the shoulder. Let's say this is my painful shoulder. I'm going to stand up. So this is almost like rowing a boat. So I got palm down on my painful shoulder. This is palm out. And I'm just going to stretch it back like this.
I think you meant paddling a canoe.
Oh, yeah. What did I say?
Rowing a boat.
Oh, well, I know. You're rowing a boat. I don't know.
No, a boat has oars.
Oh, sure.
That's a minor thing.
I don't do those things, as you can see.
Well, there might be viewers who might be hollering at you.
Yeah, that's right. I'm paddling a canoe.
So if we're looking at it from back, it's not out to the side of it. You want
Yeah.
it behind you.
Straight back.
Yep.
As pain allows, we're not looking to increase your pain. Just go up, and I just want you to do a good 10 repetitions. This one you can do a couple times a day if you want to.
Sure. You bet.
Now, let's say you get to the point where that's gotten pretty easy. It's almost similar to the other side.
Yep.
You can stop that one then. Continue the posture one. Continue the progressive Statue of Liberty.
Yep.
But you can stop that one. Now try this one.
So what do you mean if you go like this and it looks like,
Yeah, they're pretty similar.
yeah, if one like this, one like that, it's not enough, but, you know.
If not, continue doing it until it's
Yep,
pretty
they're-
close.
They're even.
Next one is you're going to get internal rotation. So I'm grabbing the lower one,
This is the stiff arm?
the stiff arm. Yep.
Okay, so
Palms going out. It probably might you only go that far to start off with.
Sure.
And this was palm forward, and I'm just sliding up like this.
So, oops.
Yeah, there's a
Ceiling up there. And this, you need to do it with some clothing on because it slides on
Right,
the
right.
stick much better. We've done this with you can do this with a belt where you pull.
Yep,
This is quite a bit easier.
Yeah.
I think.
the belt works too.
Yep, it does.
And if you get up to this point, you might even do a few of these where you actually tilt the stick forward, and we call this the chicken wing.
Yep. So,
So-
again, this is a stiff shoulder. You can see, at this point, you're doing quite well.
Yeah, you're doing quite well if you can do this.
This is getting advanced in regards
If
to
you
the-
don't like this one, don't do this one. Just stick with this one.
So all these stretches are going to be a mild pain, a stretch pain. If there's
Right.
sharp pain, it's too much. You're going too aggressive.
Yeah, back off.
Yep, you don't want to tear any tissues in there and get it all flared up and sore.
Now, if you get to the point where that's pretty much normal, no more pain, seems like you kind of hit a plateau, then you can go ahead and do supine, means laying flat on your back, and you're going to take the stick and you're going to work on just going overhead like this as far as you could go. And the right arm, or the non-involved arm, is going to help the sore arm.
Right.
It's going to help it take it further and further. You can keep your hands close together if you want to, and it'll help it move it further apart, or you can put them apart like this. You can do a little bit of both even.
You do whichever technique allows more range of motion with less pain. So you're
Yeah, very good point. And, once you start getting full motion like this, you're getting pretty close to finishing this program.
right. Yeah, you're. That's pretty good.
That may not happen during this phase, to be honest with you, Brad. It may happen during the outside phase.
Speeding things up here a little
Right.
bit, but you got to be optimistic.
I just want to include all these things in case you do get to that point. The final thing is you could do the towel on the wall, Brad. Do you
Sure.
want to show that real quick? So if this is going fine now, you can stop this one. You're still doing the posture one. You're still doing the Statue of Liberty one, and you can add this one in there too.
I don't know if you can see the towel against the white background here, but I have a towel there. And the towel is just so it slips on the wall, but it offers some resistance.
Yeah, it's like wax on, wax off,
Yeah.
isn't it?
I got to be honest with you, Bob. I always have people do the ball.
Do you?
I just love the ball on the wall.
All right.
So, but you can use the towel if you happen to have a ball. You can and roll it up like this.
And there's a little resistance with that too.
Well, the weight, yeah.
I mean, the weight of the arm trying to get up.
Yeah. And so whatever
Yeah.
you have around, you don't have to go buy a ball. Just use a towel. It works just as
Whatever
good.
floats your boat, as
Yeah.
they say. So, all right. Remember, this video is a part of a series of videos. So we're doing 3 videos on how to treat a frozen shoulder, all 3 phases. You've seen the frozen phase. That was this one. You can, if you want to go back, you can find the freezing one, and if you want to go forward, you'll find the thawing one. Go to bobandbrad.com.
Yep.
Go to the program section. Look for shoulders, and under the shoulders, it'll have all the videos listed.
And remember, we have a PDF printout with each video that will show you or give you information on what the stretches are, so that you don't have to go back to the video and relook at it every time.
Very good.
Yeah, very convenient.
Thanks for watching.